Welcome to Ask Dr. Miven. Today's question is on liquid biopsy. I'll be discussing three different tests: the Oncotrace, the Onco-D-Clare, and the Galleri. Let's first discuss Oncotrace. This is a liquid biopsy. It involves whole blood sample, and this test is particularly used for established cancer diagnosis or anyone with a history of cancer. This test detects the presence of cancer cells by detecting circulating tumor cells. These are released from the primary tumor into the bloodstream. And the cells are separated by a multi-parameter flow cytometric method that differentiates between circulating tumor cells and white blood cells, and it also separates the red blood cells. This test discriminates subpopulations of circulating tumor cells, or CSCs, or cancer stem cells. It is also known as tumor initiating cells, or TICs. The test can also detect the tissue of origin, but it's limited by the availability of specific antigen cancer markers. It also determines the prognosis and risks. The risks are resistance, recurrence, and aggressive risks. There are specific tumor stem cell markers on the surface of the CTCs that determines the risk and prognosis of the disease. For example, a specific tumor stem cell marker, the SOX2 and the OKT4, these markers are tumor stem cell markers, and when they're present, detected on the surface of the circulating tumor cells, they increase the risk of disease recurrence, resistance to treatment, and aggressive risk. And that means the prognosis is not good. Another determinant for high risk is metastasis, and that's determined by c-Met, which is mesenchymal to epithelial transition. It is a surface receptor that when it's positive detected, it means that it's highly metastatic. So this test screens for circulating tumor cells specifically. The detection level of this Oncotrace is 1.3 CTCs in 10 million white blood cells. So it's a very small number of circulating tumor cells detected, which is what makes it a rare event. In many cases, when the CTC numbers are very low, it is not detectable by conventional scans or imaging. Usually, in order for imaging to detect a tumor, the number of cancer cells lumped together would be around 1 billion cells, or about the size of half a centimeter of mass. And it can only be confirmed by a tissue biopsy. So often you will be seeing very low CTC numbers, and without a confirmed tissue biopsy, this test has a high accuracy of detecting CTCs. The true positive is 86.2%, and the true negative is 83.9%. That means to detect a cancer cell, or a CTC, if it's detecting 86.2%, that is true positive, that means the false negative is 13.8%, and the true negative is 83.9%, and that's a false positive of 16.1%. The next test is the Onco-D-Clare. Again, this is a liquid biopsy. It is used for healthy population with no history of cancer, but with risks due to a family history or vulnerability from environmental toxin exposure. It will detect cancer in symptomatic or asymptomatic people. And the early detection of cancer is the most important aspect of this test. It can detect cancer presence even before a CTC is detected. The methodology for this test involves analysis of gene expression profile of peripheral blood mononuclear cells, such as lymphocytes and monocytes, and by analyzing their gene expression profile, combining it with algorithms, specifically hierarchical and k-means with artificial intelligence, this method of testing gives a high accuracy of 92.4% true positive and 94.78 true negative. It is a game changer because it does not have to be detecting cancer cells or DNA from cancer cells, since this is detecting only the DNA of the peripheral blood mononuclear cells. So we're looking at healthy cells and not cancer cells, and be able to determine the presence of cancer. It actually discriminates between a healthy blood sample and a cancer sample. So the report is straightforward. The Galleri test, which is a liquid biopsy, is also a cancer screening test for healthy population with no history of cancer, but with risks due to family history or vulnerability from environmental toxin exposure. The early detection of cancer is dependent on release of cell-free DNA fragments. These are DNA fragments released by healthy cells and cancer cells. The method is known as next-generation sequencing. It's a DNA study with machine learning algorithms identifying cancer signal by the methylation patterns found on cell-free DNA. The true positive is 51.5% for all cancers across all stages, and 76.3% for 12 of the deadly cancer classes. The true negative is 99.5%. That means there's 0.5% false positive. So in summary, the Onco-D-Clare detects cancer by analyzing the gene expression profile of peripheral blood mononuclear cells, such as lymphocytes and monocytes. It does not depend on detecting the cell-free DNA of cancer cells and regular cells. The Galleri test is strictly a DNA fragment study, specifically cell-free DNA from cancer cells and healthy cells. By studying the cell-free DNA using machine learning algorithms, identifying cancer signal by methylation patterns found on the cell-free DNA, that's their method of discriminating between a cancer sample and a healthy sample. The Oncotrace, on the other hand, is strictly detecting live active cancer cells, known as circulating tumor cells, using a multi-parameter flow cytometry. Now that we have discussed the difference between the three different tests for cancer screening, I would recommend that if you have not had any history of cancer or have had any previous diagnosis of cancer, but you have risk due to family history, I would recommend that you request for the Onco-D-Clare test, and it will straightforwardly tell you if you have cancer or no cancer. If you have been diagnosed with cancer in the past or are in remission, then the test that you need to request is the Oncotrace. This detects circulating tumor cells needed for the baseline, as you will be doing comparison testing when you do a follow-up a few months down. If the CTCs are decreasing, then it would mean there's favorable response to therapy. And also if the cancer stem cell markers become negative, that means significant improvement due to reduction of the subpopulation, since these subpopulation drives the disease. If you have any questions about these liquid biopsies, please state your comments in the comment section of this video. And also you can send an email to Ask Dr. Miven, AskDrMiven at pm.me. Your questions will be answered in the next video episode.